privilege of just traveling around our whole system. As I visited with my colleagues in some of these rural communities and our regional facilities, one of the challenges of rural America is burnout. There's no question. I could relate to it really because I'm a country doc, and so wore many hats in that environment. And my partner and I were on call in the early days, every other day, every other weekend. Over time, that really begins to wear on you as a physician. Your ability to give your best to patients, right? I mean, you can't give your best if you're not taking care of yourself.
When I struggled with burnout was probably when I was trying to keep up with other people. My mind was always focused on what's the next step. When I get this, when I achieve that in my career, then I will have made it. And then I got there, but there was something missing.
There's the traditional stressors that are obvious to people, and that would be increased EMR responsibilities, the amount of documentation that tends to pull providers away from the connection, away from the bedside encounter that got so many people into the field of medicine. What I'm also seeing, which might be more behind the scenes, is the reality of just the increase in anxiety, increase in almost frustration that might manifest in depressive type symptoms, where people are feeling more and more overwhelmed. We've just taken on this oath to serve other people, even at the expense of our own lives.
Things are changing pretty rapidly in terms of expectations for work-life balance. And so that's what really sprung the concept for Light. Focusing back on them and saying, if you are well, you can give better care, and there's studies that have shown that there's better outcomes for those patients.
LIGHT is an acronym for Live, Improve, Grow, Heal, Treat. And we develop that for each component of how we're helping physicians, nurse practitioners, and physician assistants. We want them to have support at residency all through retirement. My job is to help them find meaning in medicine again. The most common way is through our executive coaching program. Many times our providers have just lost that temporarily in all this busyness. They just have lost where is the purpose and where is the meaning and why did they go into medicine in the first place.
We have this mentality, go to work hard, provide for your patient, you're done, right? Go home and do whatever you want. But to me, it's a way of life. And I think the LIGHT program is a great way to keep us at the top of our game and not get burned out. So the fact that they care is amazing. It's awesome. It's a blessing to be able to be in a healthcare system where they care about you and your family, and in turn, you can provide the best care you can to your patient.
I had several of my physician friends retire. One of them came up to me after he had retired, and he looked me in the eyes and he said, "Jane, don't ever retire." What the retirement grouping has helped us do is to rethink how we live. And if you're not a physician and you don't come into an office, then you have other activities that you must do to make life meaningful. Those things you have to build into your life now to make it meaningful afterwards.
Your work is not done when you get home because there are things that I need to step into as a father and as a husband. And obviously I have an amazing wife at home that she navigates the ship there, so it's easy just to step into the things that she's been doing, but oftentimes really wanting to embrace that role that I can to help the family dynamic function.
I hear stories with physicians who are in their 50s, 60s now having a lot of regret where they didn't know their kids growing up. Even though he has two really committed things in his life with work and family, he puts 100% effort towards being all dad when he's home. He's so silly and adventurous with them, and he's a great dad.
There are so many things that I enjoy about the LIGHT program. It's really designed to give people many different strategies to be whole and to make our life as positive and good as possible.
We've done things like women in medicine gathering together, couples retreat, no agenda socials, light lunches we call them, where we just kind of gather for lunch. And so that gathering concept, I think, really has a lot of power.
As we help our patients and care for our patients, we are also caring for each other and for ourselves now. And that's been wonderful to be able to carry out the mission in that way. It sounds pretty simple, but it's a whole new way of thinking, and we're actually shifting culture. The LIGHT program says to our providers, we care about you not just for your productivity. We care about you as a person.